going to send it to you. Okay, good morning. And if you want extra point on your exam, your exam is gonna be on Wednesday on this chapter. Turn this chart in and I'll give you extra points. Okay, so let's get it where you can see it. Okay. This will be a continuing, because it doesn't matter if you are pediatric or if you're adult, you still can have the pathologies, okay? So I'm gonna send you this chart, and you're gonna tell me about the functional masses that are mentioned in this chapter. I read it, there's no functional masses mentioned in this chapter, but what are some of the functional masses of the ovary?
How we get it, Miss Lucas? So,
No, I'm just asking you right now. What is a functional mass of the ovary? A follicle.
Yeah.
Come on, guys.
Yeah.
Think about it. A follicle is considered
Functional.
a mass. Even though it's a benign mass, it's still considered a mass.
Right.
Another one is a corpus luteum. And then a corpus luteum, you've got two of them. You've got corpus luteum of menstruation, and then you have corpus luteum of pregnancy. Okay, so just out of the ones that are mentioned in this book, because this is gonna be a running document, so make sure you save a copy of it on your computer or whatever. Okay, so your benign functional cysts, of course, those are gonna be follicular and corpus luteum. And you're gonna tell me what it looks like, if there's any labs elevated, if it's unilateral or bilateral. I am not gonna explain this again, girls, so you better start listening. Okay, I'm not explaining it again, okay? You're gonna tell me what age it comes to, and if it's malignant or not, okay? This is what I want done, and it's due on Wednesday, okay? You have epithelial tumors, you have germ cell tumors, you have ovarian syndromes that are mentioned within the chapter, you have fallopian pathology. I don't think any of that was mentioned in this chapter. And then the miscellaneous, okay? And that I'm gonna send to you.
What's the last one? I had seen miscellaneous.
To Sono. Okay. Now, some of this stuff we're going to talk about today. Patient preparation. Patient preparation is just like the adult, except for you don't drink so much water because they've got a smaller bladder. Okay? Now, this chapter is on pediatric and adolescents. The younger the child, the more you have to explain to them on what's going on, okay? You show them the transducer. You have them touch the transducer. You call it a camera because they're not gonna know the word transducer. So this is my camera, and I put this jelly stuff, and you can squirt it on you and show them what it looks like on the screen, because you have to do age appropriate care for these children that are going to be examined. Okay, so you don't want to just go in there and say, have a seat on the table, get up on the table and lay down and start your exam, because then they're going to panic and you're not going to be able to do their exams. Okay, So you want them to feel that the gel is warm, that it's not cold, it's not sticky, it's not, it's just gonna soak into their skin. You wanna use the highest frequency transducer that you have available to you, that can penetrate the body. Now, the older adolescents, you're gonna have to use a lower transducer, megahertz. On an older adolescent, you're going to need a lower transducer, but on a younger patient, you're going to have to use a higher transducer. Okay? Usually we want to use a curve because it gives us a greater field of view. Okay? A curve will give us a greater field of view. It's just like the adult exam, except for we're doing it on a pediatric patient. The same exact images, except for we don't do an ED. We don't do endovaginal. When you're measuring the volume on a pediatric patient of the ovary, is going to be the most accurate. And I think it's length times height times width times 0.5 something is how you find out the volume. A 12 transducer, yes, you could use that. Just remember though, your limited view is going to be a rectangle because it's only a linear. Okay, we don't have a curved in a 12. Okay. If I am doing a baby up on the floor, like a NICU for precocious puberty, not precocious, but for ambiguous genitalia, I'll use the same transducer that they use for neonatal head because it's an 8. Okay, so, and the biggest curve that we have, I think, is a 5. Okay. Okay, so here is a normal uterus. Notice the measurements at the bottom. This is done automatically for us by our machines. Okay. This is a uterus. This is a mass. More than likely, it's going to be called a dermoid. I don't know what it says down here. D revealed a tubular exploration of the the appendix areas revealed a tubular structure. Okay. This is what a dermoid looks like. If it's bowel, what's it going to look like?
Black.
It's going to be
anechoic.
It's going to be anechoic posterior to this bright echo. Okay. And here you can see the vagina, the cervix, and the uterus. This is an appendix. If the patient comes in with right lower quadrant pain, we always have to consider that they have an appendix. Their appendix is inflamed. And what we do is we do with and without compression, meaning we keep our hands the same. Here I have without compression. Here I have with compression. And if it is inflamed, it will not collapse on itself. But that's exactly what an appendix looks like. A rhabdomyosarcoma, it's the most common malignancy for our 4 and 5-year-olds. I think in the book it says 3 to 4-year-olds. Okay, so this is wrong. It's a solid mass. It could start necrosing. If it starts necrosing, meaning dying, the tissue is dying, then I can have an echogenic foci, and those echogenic foci will not shadow. It usually happens in the trigon, and the trigon is in the inferior posterior part of the bladder where the ureters go in and the urethra goes out. Okay, that's where the majority of the rhabdomyosarcomas are. So these are the different types. You can have a 10% chance of developing cancer in the dome. 80% chance, or 80% of those are gonna be papillary. Now, when we see a malignancy, it's gonna look like this. Your main mass, and it's gonna have little stellite fingers that come off of that main mass. In situ, that means the mass is there, but it has not metastasized anywhere else. In situ. Uncommon urinary tract neoplasms are, this is called a dysgerminoma. A dysgerminoma, it's uncommon, but you can get those, and they're usually in the urinary tract. Other types, you can have transitional cell papillomas, leiomyoma. A leiomyoma, another word for that would be a fibroid. Okay, it's just another word for leiomyoma. A neurofibroma, then a fibroma, and a hemangioma. A hemangioma is a cluster of vessels that give it a mass appearance. We mainly see them in the liver. Gartner's duct cyst. Gartner's duct cysts are a leftover of the Wolvian duct in the vagina, and that's why when we pull the transducer out of sexually active females, we always look for a Gartner's duct cyst because they're always in the vagina. Okay, and then of course PID. PID, with a PID, you're going to have an increase in white blood cell counts because of the inflammation of, it's usually going to be a sexually transmitted disease. The malignant types, you have the rhabdomyosarcoma. It is usually going to be in the muscle. You have an endodermal sinus, also called a yolk sac tumor. So this you are going to be born with. And a clear cell adenocarcinoma. Benign, you're going to have ovarian cyst, a follicular cyst, a corpus luteum cyst, a corpus luteum cyst of pregnancy. You can have a teratoma, which is a germ cell tumor. For us, it's usually going to come from the ovary, and what we call that is a tip of the iceberg, kind of like what we saw over here. That would be called the tip of the iceberg. I can see the beginning of the mass, but I can't see what's underneath the water. Okay, or tip of the iceberg.
And that was which one was that one?
That would be a teratoma. Most teratomas in adolescence are going to be cystic. Okay, they have hair, teeth, sebaceous fluid, things like that that are in there. So as the teratoma gets older, then it will start calcifying.
Is it the same thing with dermoid, right? Dermoid also have teeth, hair.
A molar pregnancy?
Dermoid.
That is a dermoid.
That's dermoid?
Yeah, that is a dermoid. If there is calcifications inside of the dermoid, then you're gonna have posterior shadowing because ultrasound can't go through the calcifications. Germ cell tumors are our most common malignant. Even a dermoid, it is benign, but it can turn malignant. Okay, so they always take them off. A dysgerminoma, it's the same thing in a male, like a male, it would be called a seminoma, but in a female, it's called a dysgerminoma. You're gonna have lots and lots of color, and with that, you're gonna have an increase of HCG. HCG tells our body that we're pregnant, right? So why would a pediatric patient have an elevation of AFP, of HCG. So if you have HCG